Welcome to What the Health, the show where we talk about trending health and wellness topics. I'm Noelle Bellow, and today we are getting a little personal with what we have here today. We're talking about something that a lot of women don't necessarily look forward to. It's something we get a little uncomfortable with. I'm talking about the pap smear. A lot of people don't even want to say the word. We're around the office talking about doing this interview, and we were like, can we say it? Can we not?
I know. Yes.
But Kara Egan is here. She is the CEO and co-founder of Teal Health, and they have created something that will hopefully make women a little bit more comfortable when it comes to the pap smear. So, Kara, what the health have you brought me here today?
I love that name. So thank you for having me. As you've just clearly mentioned, almost everyone in your audience that's a woman knows that getting a cervical cancer screening, what we call the pap smear, isn't comfortable, but it's also not easy. It's hard to find an appointment. And so what we've done is we've made it much easier for women to collect her own sample comfortably and privately and as accurately as the doctors.
And so what's funny is here you've brought what I think most people, well, most women, I should say, are
dreading,
used to, a speculum,
yes,
correct?
Yes, and this is even one of the nicer ones. It's not metal, it's plastic, It's disposable. But yeah, a lot of women actually don't even know it's the speculum that's being used. What they mostly associate with is the stirrups, right? The stirrups and the scooch, and just knowing that everything about it is not to be looked forward to, I guess.
Right, it's
invasive,
invasive,
but very important,
right?
Yes,
Yeah.
Yes, super invasive, but very important. Cervical cancer screening, again, when we say, we don't want to even say the word pap smear, I actually think it's really important to know that it is a cervical cancer screening because we don't actually call it the right thing, right? And so all women ages 25 to 65 should be getting screened regularly for cervical cancer. And you could do it via the pap smear in the olden days. And then nowadays, kind of the best way to screen is called primary HPV, and that's what we do.
Okay, so let's take it back a little bit. I mentioned Teal Health is the name of the company. Can you talk a little bit about your background and why you felt this was something that needed to be created?
Yeah, absolutely. Well, I mean, the main reason it needs to be created is what you just said, like every woman experiences it and thinks, can't this be better, right? Even in terms of our first couple customers coming in. So we just officially launched yesterday to all of California, but we have a 30,000 person wait list that we've been bringing through. And so the first 200 women off in the comments that we're getting is like, what took so long, right? So for me, my background is more, I come from a health tech background. So I started as an investor. And when I kind of thought about all of these other areas of our life that have gotten easier and easier and more accessible and more convenient with technology, we just weren't seeing that in healthcare. And so I just knew that there was a better way of doing it. But actually the most important thing that happens in a woman's annual visit really is the cervical cancer screening. So it was a way to kind of start the whole process of making it more accessible by bringing this home and adding a telehealth component.
I feel like that is really the trend right now is telehealth. Not only are we seeing at-home testing for cervical cancer now, but colon cancer. We've got fertility testing at home, which I have done myself before. I was nervous doing it because you have to prick your fingers, blood aspect to it. But why do you think that these telehealth companies and offering these sorts of things are becoming so popular right now, and how do you see them evolving healthcare in the future?
Yeah, I mean, I think in general what we're seeing is there's just a lack of healthcare providers across the country, and obviously there's certain pockets that are more susceptible to that in rural communities. But when I think about why most women are using Teal too, the number one reason is it's hard to find a doctor's appointment, right? So telehealth makes that more scalable. You can find a doctor in Florida that's licensed in California and can help address that. The second is they can't find time in their own day, right? Like, I don't know about you, but I'm pretty busy, right? I have a company, I have children.
Especially when it's something you don't really want to do, you kind of try to put it off.
Exactly. Or I think a lot for women and mothers, you always are at the doctor's, it's just for your kids, right? And so that half day that you thought you were going to reserve for yourself, it got taken by, my kid's flu or, it's camp. So impetigo, whatever they're getting at camps these days, or a concussion. So you're not really finding the time for yourself. And then the other reason why women don't want it for Teal is just it's uncomfortable, like you said. But I think telehealth is just making it easier for women to fit it into their schedule.
Yeah, definitely. So can we talk just a little bit about the wand here? This little, it's so much different when you look at the two different tools here. So exactly how does this work? Walk me through it.
Yeah. So what would happen is you come to the Teal website, getteal.com, and you request a kit. And what will happen then is you're going to to be paired with a clinician. So this is a prescription device, and it's actually really important that a clinician's with you the whole way because it's a cancer screening, right? We want to make sure that the results are good. We want to make sure you understand them. So what will happen is you'll meet with a short doctor's visit. She'll make sure you're eligible. She'll prescribe the kit. The kit gets sent to your house. It takes, on average, less than 5 minutes to do it, and you just kind of bedroom, bathroom, wherever you want, slide it in.
So it's okay.
So it's a similar profile as a tampon. It's designed for all bodies, so you go in as far as is comfortable for you. And then you slide out this soft sponge, and you can touch it if you want to prove how soft it is, right? It's almost like a cosmetic sponge. And then you just rotate 10 times. That's all it takes, right? So I think sometimes when we say it's like a tampon, people think it stays in longer. It's like, no, it's like a 10-second activity. Slide it back out. And then what you actually do is you pop off the sponge and you mail that to the lab. So we give you everything that you need to mail it back to the lab. So you have, your instructions, you have your mailer. It goes back to the lab, and then it's run on the exact same test that's done in the doctor's office.
Okay. Very cool.
Yep. And so it is the same test that's being used in the doctor's office. In our clinical trial, we showed that we had the same accuracy as when it's done in the doctor's office. So again, like we designed this whole product not only to be comfortable, but to really give you confidence that you can collect an adequate sample. Because you are doing something very important. You're doing it from home, and you're doing it for the first time. And so for us, both the clinical trial was really important. But how does this feel in your hand? Do you feel that it's sturdy, it's confidence-inducing, it's comfortable? So yeah, that's all you do. And then the results will come back. They're reviewed by the doctor. The doctor will then release the results to you. If you're positive for HPV, we'll then schedule another appointment with you where we'll explain your results and refer you to the in-person triage. So a cervical cancer screening is a screening. It's part of putting people into follow-up steps if required. And so we'll explain those to you, and then we will make sure that you get referred into a local doctor for you and really kind of follow you through and make sure that you're taking those steps. Like right now in some communities, like more than 75% of people are not taking the follow-up step. So it's really important. Yes. So it's really important to not only get screened. I mean, the screening is its own problem first, right? So
there's a barrier there of,
close to 1 in 3 women are behind on their screening today, right? And this happened both because we were talking about there's not enough doctors, but COVID and this massive backlog. And so most people are behind, or not most, 1 in 3 women are behind on their screening. And then it's also really important for the follow-up. But cervical cancer is completely preventable if caught early. HPV detects precancer.
Right.
And so we actually, if all of us get screened, we can eliminate cervical cancer in the U.S.
Which would be incredible.
That'd be pretty cool, right?
This is FDA approved, which is awesome. That I think is the main thing that people want to know. Okay, this has gone through the proper steps.
As it should.
Of getting clearance and whatnot. Who is this for? I mean, you mentioned a little bit already, the ages, but could you go back over that again? Who are you targeting?
So this is for all women ages 25 to 65 should be screened regularly. And I do think back, like we talked about, like we call it the pap smear, but it's a cervical cancer screening. And there is a vaccine for it, but even if you're vaccinated, you're still supposed to be screened regularly. And I think part of what's been confusing is the guidelines change, right? So it used to be every year, and then every 3 years, and then every 5 years. And so it's hard for people to know which cadence to do. But I would say, if you think you're behind at all, you're probably behind, because who remembers what yesterday was, let alone was it 3 years ago or 5 years ago? It's like just, try to get screened because it's important.
And FDA, does that mean that insurance will cover the cost of this? How does that work?
Yeah, so that's the goal. Right now, we're $99 with insurance, and we're in network in California with Aetna, Cigna, Blue Cross, Blue Shield, and United.
Just in California?
Just in California. So we're starting in California first, and the goal is to go national, but we really just kind of wanted to make sure everything worked and worked well. And as I mentioned, about the importance of the follow-up step, making sure we had all these doctors that we can refer you to in your local communities.
So insurance, maybe.
Yes. Yes, that is the goal.
That's
the goal
great.
is to get it as low as possible, and really it should be fully covered is the goal.
Yeah. Okay, so final question. What did you not say potentially about this magical vaginal wand?
Right? Yeah,
Did
I
I
know.
say vaginal? I think maybe. I mean, I might.
I am. Good company to say that.
So
Go for it, right? What did I not say? I mean, so for us, there are kind of 2 things that were really cool from our study. Well, 2 things that were really cool from our study. One, that it has the exact same accuracy as the doctor. And as you mentioned, it needs to go through the FDA. This is a cancer screening. Women need to have trust in it. So that was really awesome for us. The other part is 94% of women prefer it to the standard of care. So it is just a much preferred alternative for everybody. And then what's really awesome now that we're live is that 52% of the women that we've invited through our wait list were behind on their screening. And 20% of them had never been screened before, but were within screening age, like well within screening age.
Yeah.
So it really is creating this option for women to stay healthy in this way that like we all want to, we just can't always, right?
Yeah.
And so it's just been really rewarding to say, like, not only do we create something that everyone would prefer, but it really is helping to make sure women aren't at risk for cervical cancer.
That's fantastic. The website again, if people want to learn a little bit more.
www.getteal.com.
All right, Kara Egan with Teal Health. Thank you so much.
Thank you.
Really enjoyed the show and tell,
Yes.
and also
No, we're
just
so
learning
proud of
about,
it.
Yeah, how much this is really going to help women all
Yeah.
around the world.
Thanks
Thank
for
you.
having us.